Hello, I'm Dr. Brad Holmberg. I'm founder of InvisalignDoctors.com. Do you use the 3D controls to set up your deep bite Invisalign treatment plans? The use of the 3D controls provides the doctor with complete control over the process. This is the first video of a four-part series that will focus on deep bite cases. You will learn how I positioned anterior teeth and added attachments to optimize the outcome. Each video in the series will be a different case. So let's take a look at this case. This is a 28-year-old female patient. So she has a deep bite. She also has some spacing, by the way. She has, I'm looking at everything at stage 0. Her arches look pretty good, actually. Very little change in her arches, although they do move posterior teeth a lot. And I usually like to dial back posterior tooth movements, especially if they're unnecessary. You can see the wear facets on her central incisors. For 28, that's pretty significant. There's the deep bite, and notice the super eruption of her lower anterior teeth. This is a typical deep bite case that you see often in your practice and where you're going to want to recommend Invisalign treatment. By the way, she has a class 1 molar and cuspid relationship. So this is a deep bite class 1 case. So the first thing I do is I always set up the arches first. Now I just finished publishing a 4-part series that focused just on arch development and how I use the 3D control. So I'm not going to go through a long, extensive process or show you how I use the 3D controls. Go back and watch those videos because it's very informative. But what I am going to do is I turned on the 3D control. I just clicked Modify Treatment Plan 1. I turned on the toolbar, and I'm just going to right-click and make all the posterior teeth movable. Then if there's any slight movements, rotation, maybe a little expansion of posterior teeth, I'm only going to add back the movements I need. So I'll be back after I finish developing the arches. So I finished setting up the arches, and I also ran Live Update, and Live Update restaged everything. Now we're down to 23 aligners. There were 43 before I set the arches. The only thing I did is I worked with the posterior teeth and I set the arches. Now there is something specific, so you can see this right here, there's a lot less movements, but there's something specific for deep bite cases that I want to bring to your attention. So I'm going to show the occlusal contacts, and you have to go to the last stage and then highlight this. And you can see that there's hard contacts or red marks on the premolar and first molar teeth. And I do this for all deep bite cases. I create hard contacts. I do this by just adding about zero point 0.2 millimeters of extrusion of the upper and the lower opposing teeth. And in doing this, it helps support opening of the anterior bite. The last thing you want is have open or light posterior contacts in deep bite cases, because that will act against your correction in the front. You always want to see, if possible, whenever you have a movement in one area, like intrusion in the anterior, if you can program a little of the opposite movement in the opposite direction, meaning extrusion at posterior, that works out quite well. The next step for me in all cases is then to look at the upper anterior teeth and make sure that I like the levels of these teeth and check movements and maybe add some attachments that are needed. Now this is a deep bite case, so you can see if you turn on show occlusal contacts, you can see how deep it really is because the teeth get transparent. And then this is what I actually like to see for deep bite cases. I like to see that overbite at around 0 to 1 millimeters at the central incisor teeth. And what they've done is they've added in this treatment plan upper and lower anterior intrusion. I always check the patient's smile photo and I say, how much display of gum tissue? Does she have a gummy smile? Or does the patient not show teeth? This patient has a normal display of teeth, very little display of gum tissue. It's going to be okay to intrude these teeth a little bit. The other thing I do is I check for tooth movements. Let me get rid of the path or the transparency. So I turn on the 3D controls again because I ran live update. I have to turn on the controls again in order to start another revision. I always check the crown angulation, this right here, of posterior teeth and cuspid teeth. And I like to try to get this value under 2 degrees because it's difficult. Well, here it's 0. Let's look over here. But here it's 9 degrees. I mean, if I were to increase this just one click to 10 degrees, it becomes a blue level root movement. I like to stay as far away from blue level root movements as possible. So I'm going to just click this value down. I'll go this way. So now and this doesn't compromise anything at all. Then I'm going to just check quickly see if there's, how much intrusion there is. Just check these movements real quick. Now here's some crown angulation. But you need that because you can see that it just needs it to align the tooth. So the incisor teeth and everything, you have to allow some of that crown angulation change. It's just the cuspid teeth and the premolar teeth. This looks good. There's a programmed intrusion. Looks pretty good. So now what we have to do is we have to close the spacing. And when we close the spacing, you're going to see because there's a tooth size discrepancy, and your options are either you add restorations to the lateral incisors, or if you want to close all the space, I'm going to just relocate some of the space, just for now anyway, distal to the upper cuspid teeth. And even when I do this, after closing the spacing around the laterals in the treatment plan, there are premature contacts here. They're going to show up heavy right there. So we have to resolve that.